Hello everyone, hope you all are good. So now think about the changes that happens to our body as we grow old. What all changes do you observe? So yes, you observe wrinkles on your faces and your body. Your skin becomes very loose, right? And soft as we grow older, okay? So like your grandparents, you can notice these changes on your grandparents. Um, Now, these are the changes that we can observe. Now, let's look at the changes that happens inside our body, like to our cardiovascular system as well as to our bones and muscles. Now, what is the cardiovascular system? Well, cardiovascular system is also called as the circulatory system. So cardiovascular system is also called as the circulatory system, and the circulatory system consists of the heart and the blood vessels. The two main types of blood vessels are the arteries and the veins. Arteries carry oxygen rich blood away from the heart to the body, whereas veins carry oxygen less rich blood towards the heart. So these are the two main blood vessels. Now, the common change that you can notice in our cardiovascular system is the stiffening of the blood vessels and arteries, and this causes the heart to work harder to pump blood. So the blood vessels and the arteries they stiffens, and this increases the workload for the heart, and the heart muscles adjust to the increased workload. And the heart rate, while you're at rest, the heart rate will be the same as it used to be, but your heart rate won't increase when you exercise. When you do physical activities, your heart rate won't increase much. It will, but it won't increase much. So why is it? And why is it like important for the heart rate to increase? So these all are the changes. As you grow older, it won't increase much when you exercise. But why is it important for the heart rate to increase while you're doing some physical exercises or activities? So yes, it is important because your muscles need more oxygen, and so therefore your heart pumps more blood. Okay, and this makes the heart beat faster and pump more blood, more oxygen rich blood to your body. So your heart rate has to increase while you're doing any exercises, and these all changes can increase the risk of high blood pressure or hypertension. So these all increases the risk of high blood pressure or hypertension. Now what all can you do? Now hypertension is caused, it can be caused when you're smoking, so do not smoke. And also you should maintain a healthy weight. Obesity, diabetes, these all can cause hypertension. Now what all can you do to prevent this? Include physical activities in your daily routine. Exercise more. Do jogging, do swimming, whatever you like, you do, okay? Because it helps to maintain a healthy weight and it reduces the risk of heart diseases. Next, eat healthy food. Eat lots and lots of vegetables, eat a lot of fruits, high fiber foods, and limit foods that are high in saturated fat and salt. Okay, so eat good food. Then get adequate amount of sleep, because sleep is very important for relaxing your heart and your blood vessels. Yes, sleep at least for 7 to 8 hours. And do not smoke, because smoking contributes to the stiffening of the blood vessels. Okay, so smoking is also very harmful to your lungs, so do not smoke. Now these all you can do. Okay, so like you can prevent high blood pressure and you can stay healthy. Now let's look at the changes that happens to our bones and muscles as we grow older. Now right now your bone is very strong, your muscle is very strong, right? If you're exercising your muscle, you will grow your muscles. And yes, so as we age, our bones they tend to shrink in size as well as in density, and they become weak, and they also become more susceptible to fracture. That means they can get easily fractured. Okay, so this is what happens to our bone. They will become more susceptible to fracture. Now our muscles. Right now your muscles might be very flexible, you might be very strong, but as we grow older, your muscles will become less flexible, it will become weak. So these all can, these factors can affect your stability, your balance, and your coordination. So muscles won't be as strong as it is right now. Now what all can you do? So again, include physical activities, exercise like weight bearing exercises, jogging, walking, running, and also weight training exercises. This can help your bone and muscles. Okay, do these exercises. And next, get adequate amount of calcium and vitamin D. Now calcium and vitamin D work together, they both work together. So if you have adequate amount of calcium can help in bone growth and maintaining a good strong bone, whereas vitamin D helps in the absorption of calcium. So if you have calcium and you do not have adequate amount of vitamin D, so this calcium won't be useful because vitamin D helps in absorbing the calcium. Okay, now calcium rich foods like you can eat salmon, dairy products, tofu, and these all are calcium rich, as well as vitamin D you can get from the sunlight. uh, Sunlight, egg, salmon, yes. So these all you can do to get strong bones and strong muscles. So these were the changes. These were just a few changes. In the next video, we'll be looking at more changes. Okay, so there are more changes. So thank you. Bye.